Hello everyone, this is Soham. And welcome to my YouTube channel, which is Nurses Tip. This channel is designed to help all the nursing students all over the world to clear their nursing schools. Now, what I'm going to do under these videos, I would upload so many different videos on different nursing topics, pathophysiology, pharmacology, so that you can easily remember, and I will tell you the tricks how to remember it. And if you got any questions or anything like that, you can write in the comments. You can request for any videos. I will try to put all these videos as soon as possible. And now, today my topic is nursing notes. Now, obviously, you might have heard nursing notes in your nursing school. Now, how do you write it? Different people have different ways of writing nursing notes. How I remember writing nursing notes is I remember from top to bottom. Now, when I start from top, it comes my head. Like this is top. That's pretty simple, isn't it? So when I write as a nursing note, obviously I can't write head. So what I do, I would write the professional way. I would write CNS, which is central nervous system. Now, before writing that, what I do is put your date, nursing notes, and the ward you're in. It's a pretty simple way. Informing that you're writing nursing notes, because if you must have seen through a placement or even at universities, why we write nursing notes, because in the patient notes you have doctor's notes, pharmacist notes, you've got any other social worker's notes, so you have to write your nursing notes. You have to write this on the heading of nursing notes, so that they know that it's written by the nurses. So so that's the date, and then nursing notes, and then the ward you are in. So that's pretty simple. Now, when we talk about the next step is the body of the note, which is starts with CNS, central nervous system. When we talk about central nervous system, I mean our brain, whether it's functioning properly or not, whether the patient is alert or orientated. So you can put that patient alert, orientated, nil problems found. That's it, done. Pretty good. If patient is not alert and orientated, what we do? So that's the point. So under the nursing note, just remember what has happened, what you've done, and whether this has shown any effect or not. So these three things you have to remember. So when you say patient is not alert or orientated, you talk about sedation score, you talk about Glasgow Coma Scale. If you don't know what I'm talking about, a Glasgow Coma Scale, I will talk under neurological video. So this is a separate video, but on this, let's say if you know about what neurological observation, you can say GCS, which is scored out of 15. So you can write down that and what you've done for it. If somebody's score is, let's say, 8 or 9, have you done something for that, or you've done anything? So you tell the med team aware, and any kind of medication given for that, or what you've done under this. So that's the central nervous system. Next, after head, what we got next? We got two systems in this thoracic cavity, right? We got our lungs, we got two lungs, and we got one heart. So you can start with respiratory system. That's how I do it. Rest. When you talk about respiratory system, what we talk about that? We talk about whether saturating well or not. What's the oxygen level? That's the main thing, isn't it? So you can talk about, let's say, saturating 98%. That's well enough. Very good. Nil problems found. No accessory muscle use. What do I mean by accessory muscle? So if somebody is struggling, so you're using all this accessory muscle. If somebody is not struggling, pretty much calm, quiet, happy-go-lucky, they don't need that. You can write nil problems found. And if somebody is saturating, let's say 89, what have you done? Have you administered oxygen via nasal specs? You can write that, and whether it has shown any effect or not. So that's there. CVS, what is that? That's cardiovascular system, which is right after respiratory system. You can talk about blood pressure under this tab. Well, what's the blood pressure like? Hypertension. What have you done for it? Have you given any hypertensive medication? Have you done anything for that? what's going on with this, you can write on that. And if you've given some medication, whether it has shown any effect or not. That's the third part. Okay, GID, same thing. So what's happening under GID? So GID means gastrointestinal tract. So it starts from mouth, goes to anus. So you don't have to talk about everything, but yes, if there is any problem, let's say, or generally what we do is whether the patient is tolerating word diet or not, or nil bare mouth, something like that, or if there is any surgery or anything, you can write under gastro. So let's say if somebody's got hemicolectomy done, which is a fancy word for fancy word for removal of colon, one part of little part of the colon, not everything. Let's say the sigmoid colon, or let's say transverse colon, or the ascending or descending colon. So basically that's a half part of the colon is removed. That's hemicolectomy. So you can talk about that. And under GIT, if there is any problem, what have you done, what was your intervention, and any effect or not. Then renal. What comes under renal? Renal issues basically talk whether IDC in situ, whether PAD in situ or not. Yeah. And if IDC in situ, APC maintained, then we talk about skin. Under skin, Gelco. We can talk about IV cannula, Gelco, or PICC line, CBC line, or anything like that, either whether that's patent or not, any skin tear, pressure area care, tendon or not. So that would be under skin. Okay. Now what comes next? I talk about meds. Meds given as started, that would be the normal one. If any special meds ordered by, like let's say stat dose, if somebody's going, let's say dehydrated and blood pressure is going low, so doctor ordered stat dose of normal saline or something. So you can write normal saline given as per phone order or anything. Yeah, that would come under medication. If any extra dose or extra medication, or patient decline medication or something like that. Social, if patient visited by relatives, you can write under that. Yeah, or mother in attendance in pediatric settings, or father in attendance. Other, you can write about any allergies they have, or you can write any recommendation, like let's say 2-hourly temperature, or 4-hourly observation, something like that. Yep, so pretty much same. And where do you write bowel serpent? Bowel serpent you can write under GIT. Under central nervous system you can write about temperature as well, whether febrile or not, because that's coming under hypothalamus, so you can write under that. So pretty much, yeah, that's it. And after that you can sign at the bottom, and yeah, that's your nursing note. So just remember 3 things: what has happened, what was your intervention, what you've done, and whether it has shown any effect or not. These 3 things under each tab you write, you are good to go all the time. Write your comments below. If you got any questions, you can write that. Yep, that's all about nursing notes.